There was a way that I could have. There wasn't enough people. But we're going to go ahead and get started. You know, even if it's two of us, we'll have a conversation by ourselves. So basically, I just wanted to have this community meeting, or not so much of a meeting, just more so of just getting to know each other and trying to see how everyone is getting through the, you know, whole pandemic, and how everybody's able to, you know, stay and survive, even without having the hospitals or the day hospitals or doctor's appointments. I know that a lot of hematologists were telling patients that they needed to try anything that they can. You know, if they're having a crisis, they need to try their best that they can at home. And if they can't, to contact your doctor first before you go into the emergency room. And now there's been reports that, you know, more African Americans are dying at a higher rate. And, you know, a lot of people speculated, and a lot of people said that the issue with that is the fact that, you know, African Americans, we have, you know, diabetes, heart disease, like all kinds of disease and stuff. And, you know, that's why we're dying at a faster rate. But for me, it just seems like a lot harder to also having to worry about, you know, a pandemic that causes people to have pneumonia and causes breathing problem. Like, I feel like we already have, you know, breathing problem, and we already struggle with breathing problems. So, you know, to have this happening has been, you know, it's been scary. Like, it's all kinds of thought going through, you know, people's head. I know for me, as a sickle cell patient, I already have the thought of a sickle cell crisis or being in pain. And to have, you know, something else on top of that that could possibly kill me, like, that's pretty scary for me. So I wanted to kind of get a take on, you know, how everybody's feeling, what everybody's doing, to stay out of the hospital, and just check on, you know, people to see how people are doing. But, you know, I guess we didn't, I don't know, maybe people are busy, or maybe people just not interested. I have no idea. But, you know, we do have, possibly we might have a doctor stop by and, you know, answer some questions. He's actually a hematologist, and, you know, answer some questions and just be able to talk to him for 30 minutes. But I didn't want to put that out there just in case he didn't come. Like, I wanted people to come, log on, and then I let them know, and, you know, they can pose their questions or get their questions ready before he logs in. But, you know, but I mean, I have so much to say, but, you know, I guess I could just do a YouTube for that. If, you know, that's the case, like, nobody's gonna come on. I definitely
No,
appreciate
actually,
my
I think
brother
this is
for
fine.
coming
I
on.
think this is fine. I think,
And
you
so,
know, between me and you, it's about getting the information out there. It's not about who is participating or who is here or who is not. You know, I think all it is at the end of the day for the community is that we need to get the information out there, and we may need to, you know, we need to let the community know what's going on, even if they don't have time or they don't feel good or whatever it is the case may be, to be in this meeting right now.
yeah, I mean, yeah, I mean, and like I said, sorry, Dr. Shah is emailing me and asking, yes, well, I definitely understand that, you know, is for, it doesn't, is the information, but more so for me, I wanted people to be here so that they can ask their questions, and they can, you know, kind of share ideas, or, you know, listen to stories of what somebody else might be going through in another state, because every state has a different, you know, case or a different volume. So I just thought it would be interesting to see people log in and, you know, kind of get a feel of what, you know, another state is doing or how they're doing. and just wanted, you know, just the conversation. But as you said, this Dr. Shah, as you said, you know, it's just the information. Hi, Dr. Shah, how are you?
Dr. Shah.
Hello,
Can you hear us?
can you guys hear me?
Yes.
Now we can.
Can't hear you guys yet. Let me work on that.
Okay.
Okay.
There, I can hear you guys now.
Okay.
Oh,
Awesome.
perfect. All right. So we were trying to wait around for people, but you know, we just decided to get started.
Yeah.
But basically what we're talking about is just, you know, wanting to see how people are doing in this whole pandemic situation. You know, we wanted to see how, not even just our fear, but you know, how people are holding up, being at home and handling pain crisis by themselves, and things that they're doing to try to stay out of the hospital. Like, I know that the doctors are doing a great job to see, you know, patients on an emergency basis, but you know, think about it too, a month ago or, you know, 2 months ago, of how, you know, if you knew that your pain crisis was something you could manage at home, you can just go straight to the emergency room. But now that's not an option. Like, unfortunately, the emergency room is the last place that you want to be. So we just wanted to just have a conversation and see how everyone is handling it. But unfortunately, a lot of people didn't tune in, just me and my brother. So we just, you know, I really appreciate you being here. You know, maybe we'll be able to, you know, as my brother was saying before you came in, he was saying that it's not the amount of people there, is the information. So, you know, hopefully maybe they'll be able to watch and then they can, you know, learn something. But, you know, I wanted you to come in and see if people had a question for you. But did you have any question for Dr.
Yeah, I do.
Shah?
I do actually have a
Because I
couple
have
of
some
questions for
questions
Dr.
I
Shah.
wanted to
Yeah, sure. That's what I'm here for.
Yeah. Yeah. Do you want
Okay.
me to start? Do you want me to ask the first question?
Yeah, go ahead.
Okay. So right now with this whole pandemic issue,
Mm-hmm.
if a sickle cell patient was having a serious crisis, which, you know, in some sickle cell group, I saw a young man asking about symptoms for stroke,
Oh yeah.
you know, and I'm not sure if, you know, if he was having some symptoms, but if a sickle cell patient was to have symptoms like that, or they just feel like something is not right in them, you know, in our state or in our city, you know, how would they go about getting seen or getting taken care of?
Yeah. So the issue is basically you have to figure out what your threshold is that you need to be evaluated. Meaning, from pain, you know, you guys are doing everything you can to not be in the emergency room, and you only go when you have to. That's already established.
Right.
And what's changed is now, even if you felt so bad that you needed to go, now you're worried that if you go, you're a patient that is at higher risk. So, you know, should you be going? And what I would say is, I wouldn't change your threshold too much. If it's pain, I would say about the same. You know, try your best to try and stay out of the hospital. We know that most patients don't want to be there, and you're only going if you have to. If you can take a couple extra pills and we can get you extra pills, that's a key part to that, I would say. That we are doing, and I've talked to Dr. Strauss, Dr. Crawford, we've talked to all the other providers. We're being a little bit more liberal with getting pain medication. So if you need an early refill, if you need extra medications, if you need a visit, that's actually very important. If you need a visit, televisit, that's becoming standard of care. If you want to talk out how to do, you know, how to manage your pain, absolutely, we'll help you with that. So you don't need to go to the ER, even though you really, really, you know, only go when you have to. But to your point, to your question, if it gets to a threshold, like you're concerned about stroke, or you're worried that something's not right, like for sure, if you can't move, you have a weird sensation, or you can't move your arm, that's an emergency. When you cross that threshold, I would say you still need to go to the emergency room. You still need to go. Now, the moment you get there, what I would, and everyone's on high alert because of the COVID, the virus. You're going to wear your mask,
Right?
be very well fitting, and even if you have a surgical mask, I would wear a cloth mask on top of that. So just kind of some information.
Yeah.
If you have a surgical mask, that decreases the flow of viruses coming in. Again, a lot of time the masks that people wear are so that you don't get infected. It doesn't help you,
Right.
Very much. But if you wear a mask, that's like a surgical mask, it blocks out about 40 to 60%, depending on the type of surgical mask. Just, the ones that you loop over your ears. If you put a cloth mask on top of that, and it's a double layer, you can make these at home. They're very easy. We did that, ourselves. But the more you double it, then you increase that percentage that is not allowed in. So I would wear the surgical mask, and then put there's actually these bandanas you can put on top of that.
Mm-hmm.
You just use two little hair tie kind of things, and you put them on. But anyway, so that's what I would encourage. I actually walk. This is literally what I do. I walk around with a big tub of Lysol wipes. So I take when I leave the car, I take one Lysol wipe out. It's nice and wet, and everything I touch is a Lysol wipe. So because every doorknob you touch, that's one of the highest places you can get it, is a doorknob. So then everything you touch is a Lysol wipe, and then once it starts drying out, or it's touched enough things, because it's got Clorox and stuff in it. So it's not to wipe your face or anything with it, but everything you touch, and then you throw it away and you get another wipe out. If you don't want to walk around with a big tub, like I've done sometimes, which I kind of get embarrassed of sometimes, then just fold up a couple of those wet ones in a Ziploc, and then walk around with that Ziploc, and then I just take one out. And so like I picked up pizza the other day, I had that wipe with me. I opened the door with it. When I gave a credit card, I wiped down the credit card, gave it to him. I used it for the pen. The pen I had, I picked it up. I wiped it down with the Clorox, signed it, wiped my hands again. And then when I get into the car, again, I wipe everything on my hands, and then I go home. So that's I would say the same thing when you go to the ER. If you're going to go to the emergency room, have those wipes with you, and then also have Purell gel with you, just a little bottle if you have that too. And you can make those. There's a lot of online ways of making those. They're not that hard to make. So final thing I would say to answer your question, if you're having stroke, without a doubt, you got to go. If you're having major issues, you got to go. I've had a couple patients already. I've talked this through. Exactly what I said is what I would advise you to do. And then the last thing would be, when you get there, say, and you can throw my name out there if you need to, say, Dr. Shah said, make sure you knew I have sickle cell, so I'm immunocompromised. My immune system doesn't work. Is there anything you can do to help get me into a room or away from other people? And they know that, but just say it, just so that everybody's aware. Does that answer your question?
Thank you. That's awesome. Yeah. Okay. Do you have another question, sis, or can I ask another one? Because I have another one.
Go ahead. He has to go soon, but go ahead.
Okay. So my other question is, have you, as a sickle cell doctor, experienced any sickle cell patient with the COVID right now, and how are they doing? Are they managing good? How is their oxygen? That's my main worry.
Yeah, it's another really good question. So I don't personally have anyone that I know of as of yet. That might change in the next couple of who have family members that have it, and they don't have anywhere else to go. So they're in the same house. The one patient I talked to lives in Fayetteville, and his aunt had it, And they were handing the phone back and forth while they were talking to me. And I'm like, no, don't do that. Don't do that. Stop doing it. You're already passing it back and forth. But so I'm sure he may have it by now. But that was a couple days ago. And then I have another patient whose other family member has it too. He actually was in the hospital for a fever. He went home after like 24 hours with pain treatment. His fever went away. He was negative. That might change. So from personal experience, I don't have any patients. But what I can say again, because I think it's a really good question, is what do you need to worry about? What do you need to think about? What have we seen with sickle cell patients? And we do have a national registry. So all of us sickle cell docs said we need to be organized about this. So we're recording all our patients with sickle cell that have any treatments, or have the virus and what happens to them. What we've seen is a little bit of what we would have expected. To your point, patients do have low oxygen levels. There's something funny about this virus, and I'm not going to get too scientific on this, but the virus seems to interfere with the hemoglobin itself. So even if you didn't have sickle cell, it actually affects the hemoglobin, it affects the iron in your sickled cell, in your hemoglobin, in your red blood cell. So the sickled cell and even beta thalassemia make it so that your oxygen issue is more of a problem. And so that's why there's a lot of beta thalassemia in Italy and in Southeast Europe, Spain. So you see that Spain and Italy got hit really hard. So there's some folks that are kind of feeling like, because there's a lot of beta thalassemia, maybe that's because it also interferes with the hemoglobin, and that's why they had a big problem. So again, I don't know that's what's going to happen with sickle cell. We don't know that yet, but I just bring that up that yes, it does seem to interfere with oxygen. So the worry with sickle cell, of course, is acute chest. The standard recommendations, again, just so that you're aware and you can spread this information, is that if you get the virus, my standard of care is you need to be exchanged. You just need to get an exchange transfusion and take sickle cell off the table from the beginning. I think the official recommendations that came out from ASH, the American Society of Hematology, and some other hematology groups is that you need to at least be transfused. I always go the next step. If possible, I would just exchange you. Take as much sickle cell out, put non-sickle cell in, so that you're only dealing with virus and not dealing with sickle cell for that time period.
But then I heard there's been an issue with people getting blood. There's been like a shortage at the Red Cross, and a lot of people are still either waiting for blood or, we had someone on social media that said that her doctor actually, sent her home and told her that, there's nothing they can do. I mean, she doesn't have the coronavirus. She just has like low hemoglobin, and they said that she's just gonna have to wait until until blood could be donated.
Yeah, I would. I'm totally distracted now with the cute little one on the screen.
I know, and like her hair is not done and everything.
But what I would say, you have to make me smile. So what I would say is, yes. So there is a blood shortage. I still would say standard of care is to exchange if possible. So if you have the blood units, I would do it. But if I can't, I would transfuse for now. If I can't transfuse, I can't transfuse. But you gotta say what is the best thing to do, and then see what to work with. What do I have to work with? What I would advocate for with your platform is blood donations. So all the families of patients with sickle cell should be donating blood. And the families are the most important, because it's really, and so there are not a lot of African Americans and African populations that are donating right now. So I definitely would, because that your blood type, the blood types and the small labels on your red blood cells are very specific. And so we want to make sure. I'm donating blood on Thursday. So next Thursday I'm going, and you have to, and make sure that because of social distancing, they're only allowing a certain number of people in. So I had to make an appointment, and it was 2 weeks out. I couldn't even go because they're just so.
Oh,
So I made the appointment like last week for next week. So it's like 2 weeks out. So but I would definitely advocate
okay.
to let everyone know to try and donate blood too.
What about someone with a
Okay.
trait?
Yeah, so trait,
Yeah, I was gonna ask.
trait can donate. Absolutely. Trait can donate.
Okay, good.
Good to know, because
And I
someone in
think you
the
have
sickle
to.
cell group asked today if
Yeah.
someone with a trait could donate because their mother wanted to donate for their child.
Yeah. So it's hard. Sometimes it's hard to try and match mom to child, but I would just
Hmm.
donate. I would just donate. And sickle cell trait definitely can. We only the blood banks only want a certain amount of trait, but in this time for sure, they're not being picky. Sickle cell trait's still much better than not having the blood. So yeah.
Mhm.
Now, if for sickle cell patients, we don't transfuse sickle cell trait, but in general.
But for someone else.
But for
It could
someone else,
help
it still would be
someone else.
good. Yes, it'd still be good. Yeah.
Awesome.
So the only question, or the only thing that I wanted you to touch on was, how, because I have a lot of fear and anxiety with everything going on. Like we have 4 people at home with sickle cell, and my husband as well as my sister-in-law are both essential workers. So they still have to go to work and, still have to come home. And it's like, we can't just tell them, no, don't come home because
Right.
they need to be home.
Right.
But for me, it's been fear, like we go through the precaution, they cover their faces. They've got, the sanitizers, the Clorox wipes, the sprays. But they take the clothes off, at the door, they wash their hands immediately, but we still have this fear of God. And if one of us catches it, like all of us has it, and it's going to be kind of like pretty hard to have 4 sickle cell sick people, and then, the little kids, and then your families are not even able to come with you to the hospital when you go in. So for me, it's like, it's scary. What are you telling people, or how are you telling people to, especially sickle cell patients, to handle this situation at this time?
So the first thing is recognize that, as you guys are well aware, that being stressed out and anxious doesn't help your sickle cell, and it's this vicious
Very
cycle.
true.
It's a bad cycle, and so doing everything you can to try and put yourself in a better place mentally is a good thing. So meditation, all the strategies that you guys do for pain, but now you're also going to be doing to try and just distract yourself from the fact that there's a lot of uncertainty going on. What I would recommend, in addition to all the strategies you just said, which is trying to just be clean and wear the mask and everything, is to take things one day at a time. So I will say, I don't watch the news as much as I used to. There's a lot of, I'm not trying to discount the virus. It is a big deal, but I'll be honest, they are trying to hype it up a little bit more to try and make sure everyone listens, because not everybody's listening. So, before they said, oh, it's not so bad for kids. And that's a true statement. Now they're trying to change that, like, oh, it's bad for kids too. And that's a true statement too. It can be bad for kids, but for the most part, the issues that kids get are very, very mild. Like 99% of the kids do very, very well. But we don't say that very often because we want the kids to stay inside and do social distancing. But the reason I bring that up is I do watch the news in a kind of controlled way, just because there's all the stories of people dying and all this other stuff. But if you look at the curve, we actually are starting to flatten out. And so that's why I say take it day by day. I actually think the virus, and you guys know I'm very much a positive thinker. I'm an optimist, but I do think I do think that the curve is starting to flatten out. Now, that doesn't mean it's going to go away anytime soon, but that does mean that I don't think we're going to have this huge surge where everyone's in the hospital and everyone's dying. And I just think what it's going to do is it's going to change the way how we do everything. And I just saw on the news there, basically, handshaking's gone away. We don't handshake anymore. No one's supposed to be
or hugging.
no hugging. We just need to not do that anymore. And my next visit with you guys will be probably via this, this platform. I'll be video conferencing with you guys,
yeah.
and that's fine. I can do a lot of conversations with you this way, and maybe we should be doing this. Why do I need to have you come out into
why not
30-degree weather when it's like very freezing outside? Why do I need to have you go through that? Can I maybe help you with your childcare? Why do I have to have you, have your kids just hopefully locked up in a room for a little bit, which is what I, have to do sometimes too. So I think that's fine. And so just take it day by day. I think just know that we're adapting to this. Don't stress out, try to be as calm as you can. It is not, sometimes it's stressful just being locked up at home. I get that too. But I would encourage you to go outside, wear a mask, but I would encourage you to go outside, just wear, like I said, a homemade mask or something, and stay 6 feet away from everybody and go for a walk around the neighborhood. Every single day, at least go outside and do something, so I think just from a mental standpoint, you need to do that.
I'm glad you said that, because I've been keeping the kids indoors, this whole time, because fear for me is not as much as it is for the children.
I know. So we just played on our driveway, and then anytime anyone comes walking by our house, we get closer to the house until they walk by, and then we kind of just come back out to the driveway again. So get them on their bikes, let them walk around, let them run around. It's okay as long as nobody else is around. Even your neighbors, kids who want to play. My son wanted to play with a neighbor because he was outside, and I said, nope, you can yell at him, but you cannot go play with him.
Yeah.
Right?
And we actually have someone in our neighborhood that has it. So
yeah.
So it's like, okay.
Yeah, and so don't play with any other balls that are out there. Don't just play with your own stuff. Play in your yard, get outside. It's okay. I'm okay with, I think that's perfectly fine, but just stay in your little, stay close to the house if you want to, that's fine.
Stay in your lane.
Yeah, stay in your lane. Yeah. I mean, my nephew, we FaceTime with him and he's blowing bubbles on his little driveway.
Yeah.
We're on our driveway doing our thing. So we're kind of talking and playing. So yep, I would definitely do that.
Awesome.
We'll get outside then, because we've been kind of locked in the house because everyone is kind of like scared. It's even crazy. Like our mom is an essential worker, and sometimes like she cooks for us, and she'll tell us your food is ready, but it'll be on the porch. Call me when you're coming. Like she won't even let us close by. So it's been kind of like scary and panicky. But I'm glad that you put a lot of stuff into perspective, because you're right. I try not to watch the news, and I try not to look at social media so much, but sometimes you can't help it. And then when you look at it, it's like, I can't sleep, for the whole night, because I'm like paranoid, and I'm thinking about
what did I test today. I had a panic attack this weekend.
He did. He had a panic attack. Like we thought we were going to have to go to the emergency room. Like he was like, I can't breathe. And then he's like, oh my gosh, it's corona. So it's good.
Full blown, Dr. John.
It's good.
You just needed a bottle of Corona. That's what you needed.
Yep.
No, I would say just, take it day by day. I think things are going to get better. And if not necessarily better, but it's going to at least stabilize. I think that's for sure in the near horizon. We're going to have better tests. I don't think the treatments and vaccines are very close. We're probably months away from some sort of treatment options just to have. But for sure, vaccines are years away. I think the best thing we can do is just do what we're doing right now. Social distancing, being very clean and very diligent about who we're with. So.
Awesome.
Now, I have one more question. Did you guys get like an increase in volume of just calls and people just with questions and?
Yeah, absolutely. And that's very justified.
Because I was one of those people like.
No, that's fine. And that's very justified. I talked to Dr. Strauss 2 days ago. yesterday we came to agreement that we're going to be sending out letters and emails to all patients, not just the ones who are calling, because I think that definitely is needed. So I don't think we're going to be doing that on pediatrics necessarily, but on adults, we're gonna start that very soon. So that you know, and, you know, it's general stuff, but it is good to have, you know, something to kind of lean on. So I'm sorry I have to go now, but what I would say is if you can have this next week, the week after, just let me know. I'll definitely try and sign on as many people I can touch and give some information to. I'd love to be able to help.
Awesome. Thank you so much for taking the time. Like, we really appreciate you. You put my mind at ease.
Thank you
We'll
for
see you
Dr.
when
Shah.
all this is over. Yes, you are an amazing physician, and thank you for being available.
No, you guys
through all our emails and everything.
Well, I appreciate you guys making me feel good, but I appreciate just keep me in touch. Let me know how things are going. We're going to get through this together. We're going to get through it.
Yes, thank you. Thank you so much. Have a good day. Thank you.
Speak soon. Bye.
Bye. So I wanted to tell a story about how Dr. Shah saved me. So I started taking Oxbryta last week, and he told me like all the side effects, and it was like supposed to be, you know, your stomach upset, headache, and all this other stuff. So what happened with me was that I had a bad breakout. Like, it was horrible. It was like just hives and all kinds of stuff all over my body. And then it was during the time where you couldn't go, you know, to an appointment. So I sent him an email and I took all the pictures and I was like, what's going on? What is this? Like, what's happening? And he was basically like, okay, just reduce the dose, you know, what have you taken? Maybe take something for allergies. And so I was like, oh, thank God. So, and then like the next day he followed up with me and he was like, you know, how's the rashes going? Like, are you okay? You know, did you have any other symptoms other than that? I was like, oh no, I'm fine. It stopped itching. You know, and he's like, just keep, you know, cream on it. But I just thought it was good, you know, not only to be able to reach out to him via email, but also to have him like, you know, follow up with me the next day, because I'm still like in a state of panic. Like, I can't go to my doctor. Like, what's happening? Like, what if I need to see him? So it was good that he was able to come on and put some insight on some things. But I'm telling y'all, I was scared because, you know, it's a new medication.
It was everywhere.
I do have, I had an EpiPen and it literally was like from literally my head down to my toes. Everywhere. It was bad. Hives everywhere. Like, I was scared. My husband was looking at me like, and it was so funny because I didn't notice it. And I don't know who it was, and somebody was like, what's going on with your face?
Your
and I was
husband,
like, what do you
talking
mean?
about your back,
And so,
of your neck.
Yeah, and then I looked at it. Then I told him to put lotion on my back, and he was like, you got to see your back. And then I just started looking all over my body and stuff, and I'm like, and it literally happened like this. It was like 1 minute, nothing. The next minute, everything is gone. But I will tell you that it was the perfect time to start a new medication because I was home. I did have some stomach upset as well. So I was home. I was able to deal with that. I was able to deal with my rashes at home. Right. But the great thing about the Oxbryta is, like, I literally have more energy. Like, I would get up in the morning and go, you know, do a 6-minute workout and, you know, be all over the house, rearranging closets and everything else like that. So if anybody hasn't started it, it's something that you should talk to your physician about. Like, I know that it doesn't help with your pain. It's supposed to just like help with your
hemoglobin. Here's what, okay. So I've been using Oxbryta for about 2.5 years now. I was one of the study folks with Oxbryta. And I was privileged to meet actually the scientist or the doctor that started it. His name was Dr. Love, Ted Love. And he explained it to us. When what's the name of that? Lance Armstrong was cheating. He was not using steroid like people thought. Lance Armstrong was improving his hemoglobin.
I'm sorry, who's Lance Armstrong?
The bicyclist, you know, the
I'm sorry, I don't
guy, The guy that ride the bicycle that cheated, that had
Oh.
a cancer and he
Oh.
cheated, and they took the Tour de France from him.
Oh.
Yeah, him. They
I know what
found
you're
out
talking
that
about at the Olympics.
yeah, they found out that the Oxbryder, I mean, before Oxbryder, he found out that he was improving his hemoglobin. That's how Lance Armstrong was cheating. He was already normal. So a normal human being with super hemoglobin turned him into a superhuman. So what Dr. Ted Love did was he went back to the lab and figured out how to make the same item and help the patient with sickle cell increase their hemoglobin. So Oxbryder is pretty much there to help you increase your hemoglobin. When I started Oxbryder about 2.5 years ago, I was 7. Now I'm a 13. I'm talking about my hemoglobin. Now I'm a 13. The first week I used that medicine, I thought I was going crazy. I had energy. I had energy. When I tell you, it's like, I asked my wife, like, yo, is this how it feels to be normal? You know, because I just had energy. I had my pain, but I wasn't fatigued. You know, so that Oxbryder, you know, I'm not doing no commercial for no drug. I'm not doing anything, but I could speak for myself. That drug changed everything. Like, I begged my sister to get on it. You know, I begged her because to me, I still have pain. I don't care. The fatigue, you know, sometimes fatigue will make someone feel like they're about to die.
Mm-hmm.
You know?
Look at her face, like, yeah.
It's the truth. Fatigue will make you feel like there is, you know, for you to feel good one day and then the next day you just feel like you are going down. It is scary. Forget the pain. Anybody breaks an arm, people don't die from breaking arm. People, you know, pain is there. But that fatigue to me was my main priority. And Oxbryder took it away. When I used to have colds, I used to be down. I used to be down. Now when I have cold, I'm still walking around. You know, I'm just sniffing, coughing. I'm still walking around. I'm still moving. You know, so that's what that Oxbryder, just that hemoglobin aspect of things changed. You know.
Yeah,
But
it's actually pretty good because Dr. Shah gave me 2 options because my issue more so was like pain, and he gave me 2 options. The other medication that's supposed to be an infusion and you're supposed to get it every month. I forgot what they call it. Zio or something, but you're supposed to get it every month, and it's an infusion that you receive, and also the Oxbryder. So he said that it would be a great idea to start the Oxbryder first because that will help with the boost of hemoglobin, and at least if I'm still in pain, I can still, you know, be able to get up and, you know, get things done, take my medication, whatever the case is. But later on, once the hemoglobin is higher, then we'll go into the pain treatment by getting the
I forgot the name of that medicine.
Then we'll go, yeah, it's like a Zia or something. But then we'll go into you know, pain treatment with the medication, and it's like once a month IV infusion, and it's supposed to like help you control your pain. So it's a lot of things that are out there for patients to use, and it's so crazy that, you know, this whole pandemic is going on because it's like so many things were happening. Like I was seeing people on social media about to travel to go do advocacy work. Like we've got the conference coming on in October that we don't even know what's going to happen with it now. So it just knocked down a lot of things.
There's like a study conference in Florida that we're gonna miss.
Florida. Yeah, and they already canceled it, right?
No, they're saying right now that they're gonna let us know. They'll keep us updated. But right now, they're not telling anybody if they got the scholarship. They're not saying nothing about it right now.
Oh, yeah.
Gotcha.
Well, I mean, I'd rather stay home and be healthy
Me too.
than, you know, try to go out there and risk anything. So I'm okay with staying at home. Like Dr. Shah was saying, oh, you might be bored. I'd rather be bored than dead. You know, because it really does scare me with us already having, like, you know, breathing issues and then having to have pneumonia. Like what I remember when I had pneumonia and I was in a hospital, it really felt like death. Like I really thought I was dying. And then with the pneumonia, I ended up getting flus in my lungs. So I ended up being in the hospital for almost a month just because I had pneumonia. So that's why I said I'd rather just be home than to die. And I know a lot of people are, you know, losing their mind and they want to see their friends or they want to see their family. But really, this is a time for us just to listen and keep the distance and just stay alive, you know.
Reflect
And
on
not
life.
even that. And, you know, when I heard it on the news that Black people are now dying at a higher rate, like that scared the crap out of me, because I'm like, we already died, like, you know, a lot. So how are we gonna have corona now taking us out on top of everything else that takes us out? Like, think about how much sickle cell patients we lost just last year and this, you know, this year, and this year just started. So I'm you know, I'm really nervous, and I'm glad Dr. Shah was able to come in and kind of shed a light on it. I'm a little disappointed that, you know, nobody else came, but